I'm also grateful to Amit for setting the stage and probably repeating many of the arguments which I am going to talk to you about. I have no conflicts of interest relevant to this particular topic, and you may take photographs of this presentation if you so wish. So, what do you mean by over the counter? Like Amit said, over the counter means you can obtain the drug or device either online or through retail without having to consult a doctor first. But again, as we said earlier, in India, almost everything is over the counter. And you can see all the online shopping websites giving offers for all sorts of sensors. Of course, the only thing in India is that we don't have too much of a choice of sensor available. As of now, only one company has hogged the market, although others are coming, but all of them are available without a prescription. But in the US, as was mentioned earlier, the situation is different. And this is from the ADA 2026 standards, okay? And they have divided CGMs into real time CGMs, professional CGMs like the Libre Pro, which is no longer available in India. Many of us are familiar with it, and the OTC CGMs. There are two devices available in the US market. One is the Dexcom Stilo, and the other is the Abbott Lingo. There is a third device known as the Rio, Libre Rio, which has been approved by the US FDA and is said to be more accurate, but it has not come to the market yet. And this is a comparison of the three OTC CGMs. What I want you to look at is the range of glycemia that these sensors measure. And you will see that, except for the Libre Rio, which is not available in the market, they do not really have a wide range of glucose measurements available. For example, for Stilo, it is 70 to 250, and for Lingo, it is 55 to 200. I'm sure you'd agree with me for that for somebody who has diabetes, especially somebody with type 1 diabetes and who is on insulin, they would tend to spend a good proportion of their lives with glucose levels outside of these values. So that itself tells you that these meters may not be particularly relevant or useful for that particular population. So what are the issues with using CGM without a prescription? Of course, if there is no prescription, that means there is no prescriber. And if there is no prescriber, who is going to provide the education? In our country, it is most usually Dr. Google or WhatsApp University. And Dr. Google and WhatsApp University are not going to tell you about all these things about pressure lows, the lag period between ISF and blood glucose, inaccuracies at the extremes of recording, and all these 42 factors. I don't know how they ended up with 42. I'm sure there are many more. All these factors that can influence the blood glucose. So people who use this get confused. They really cannot understand why the glucose levels are going haywire because they have not asked any doctor before starting the CGM and they don't have any contact to any doctor. They will be going and asking their neighbors, friends, whoever has used the CGM, and they will get the wrong information. Plus, at least in the US, when there is use of CGM in people without diabetes, they make unsubstantiated claims and promises. They claim that the CGM can unlock your metabolic status. It is a key to unlocking your metabolic status. Put it for 2 weeks, you will know exactly what happens after you eat something, how much your glucose goes up, what spikes your sugar, what doesn't, and so on and so forth. But remember, metabolism is not mathematics. There's this interesting study which was published in AJCN last year, which actually took people without diabetes and fed them different types of meals. They either fed them the same meal on different days or they gave them different types of meals on different days with a washout period in between. And the glucose levels are measured using the state of the art sensors, that is the Libre Pro and the Dexcom G4 Platinum. And what they found that was that even within the same individual, for the same meal on given on two different occasions, there was a significant variation in the postprandial response. And on many occasions, this difference was more than what was seen in the individual following two different meals. So it is going to be very difficult, at least in somebody without diabetes, to show that it is this particular meal that has led to this particular spike, again leading to confusion. Plus, it has been clearly shown that CGMs overestimate glycemia in non-diabetes. Another paper which was published in AJCN, 15 people without diabetes who ate meals containing 50 grams of carbohydrate and simultaneously they underwent measurement of glucose with either capillary blood glucose or with the CGM. And it was clearly shown that there was a consistent overestimation of glucose levels by the glucose sensors. And this can lead to stress, this can lead to confusion, and in borderline cases, it can lead to paranoia also because there is a thin line between being concerned and becoming paranoid. The other problem is that we really don't know what we mean by normoglycemia in people without diabetes. All this time in range, time above range, everything has been calculated from people with diabetes. But most people in the world do not have diabetes. Unfortunately, we don't have too much of data in that population. There are only 3 studies which were picked up, which have looked at normoglycemic parameters in individuals without diabetes. And in most of these studies, it is shown that around 88 to 90% of the time, people remain between 70 to 140 milligram. This is what is known as time in tight range. So around 90%, 95% of the time, people stay in that range. And unfortunately, that is the range in which all these OTC CGMs are least accurate. And this is because they have been derived from the prescription CGMs, which in turn were designed for use in people with diabetes. So they are not very accurate in the normoglycemia. Even normal physiological variations, they may pick up and mark as pathological variations. And the other point is that leave patients. Even experts don't agree on how to interpret CGM in individuals without diabetes. Now, this was a consensus meeting which was conducted a couple of years ago. You can see the list of individuals who is who of diabetes technology. They were given 20 CGM reports along with the HbA1c and the fasting glucose values in people without diabetes, 10 with pre-diabetes, 10 without any dysglycemia. And they were asked the questions, looking at these CGMs, how many of them do you think warrant follow-up? Answers given were yes, no, or maybe the sensor is faulty and we cannot give any conclusion. And they found that in only 3 of these cases, there was more than 50% consensus, even among the experts. So, if that is a state for experts, you can imagine what the state will be of a lay person or a person with pre-diabetes or somebody with diabetes who is using these CGMs without medical consultation. So, these are the issues when people without dysglycemia use CGMs over the counter. But what are the issues in people with diabetes? And why should somebody with diabetes use one of these machines? I think Amit already mentioned this. This usually happens when the insurance cover is not there because these are cheaper than the prescription CGMs. Classical example is somebody who is on a pump, who is also on a CGM. They run out of sensors because occasionally the sensor fails. And the insurance will only cover exactly the number of sensors that are required to cover the period between 2 consultations. So if the sensor fails in between, the patient is lost. So they have no other go but to go for one of these over-the-counter sensors. Of course, that's a problem only in the US, not in India. Plus, it is less expensive. When you count, don't factor in the insurance, the prescription CGMs are insanely expensive in the US. So remember that these devices are not meant for use in people with diabetes, especially those on insulin, for the simple reason that they do not measure glucose accurately at the extremes of glycemia. Plus, they do not have any alarms for hypoglycemia, which is a major issue in individuals with type 1 diabetes. So, therefore, it is, I would like to conclude by saying that although these devices do increase access to technology for people with and without diabetes, they are not accurate enough in people without diabetes to make any major treatment or diagnostic decisions. And they are not safe enough in individuals with diabetes, especially those who are taking insulin, to replace a combination of a clinician and a prescription CGM. And the most important problem in India is that glucose lowering drugs are also over the counter. So it's not a very long shot to think that somebody might see some value in the glucometer or in the CGM, and they may go to a pharmacy and they will give them some drug that may worsen the situation by either causing hyperglycemia or hypoglycemia. So, like Dr. Amit Gupta said, more than a problem of technology, in India, OTC CGM is a matter of regulation. So, since there is no regulation by law, we as clinicians have to take up that responsibility and select the right patient who is a good candidate for the CGM so that first we do no harm. Thank you.